the new emerging variants of concern, sort of the importance of testing and vaccinations for controlling transmission and slowing down the reproductive rate, what we have in terms of the testing landscapes and the vaccine basics, what are the leading candidates and the current platforms that we are in use, and what is an ideal vaccine and the strategy, and then some of the misinformation that people have, is it safe, is it going to be used in pregnant women, etc. So I will try to cover some of your questions, but probably there will be many more. So as we approach the first anniversary of this pandemic in just a few days, March 11th is when WHO declared it a pandemic. In this particular century, we've already had 3 outbreaks of different coronaviruses. So there's been quite a bit of interspecies jumping between its animal host and human to human transmission. We had SARS-CoV-1 early on. Then we had MERS in the Middle East, transmitted through camels, and now we have SARS-CoV-2. We still don't know the origins and early cases. There will be a WHO report that will be released later this month, and I just encourage you to keep an eye out for it because it's supposed to, they had a team that went in there to look at it. So these are all novel pathogens, meaning that we actually have no immunity to them. There's no natural immunity. Our body does not recognize this. To date, we've had about 116 million cases worldwide and 2.5 million deaths. And it's a very particular virus. It seems to really impact older adults, 60 plus, and those with comorbidities of especially in the US, we're seeing a lot of obesity as an independent risk factor, but diabetes and cardiovascular diseases are also very high comorbidities. The interesting thing about this particular virus is that it seems to have a incubation period and an infection period that is long without people having any symptoms. So we know for a fact that 59% of transmissions are from people who are basically pre-symptomatic or asymptomatic, meaning that they have no symptoms, yet they have been exposed to the virus, or pre-symptomatic, they're going to develop COVID, but the symptoms are not obvious. And a lot of the transmission happens before people, unlike the cold where you feel like you're getting sick, you may not even feel any illness or any fever, coughing, anything. So but you are emitting virus. Over the last couple of months, there have been new variants that have been emerging from around the world. So clearly the virus is finding ways to become fitter. It's not very clear whether it's becoming more lethal, but it is definitely changing its structure to become a better infector of human cells. So how is this virus spread? We all now, there's no dispute that it spreads through air droplets and especially aerosols, which are very small and can be suspended in the air for 15 to 20 minutes. And in closed settings for much longer. So that's why, the recommendation to shut down indoor dining, movie theaters, any kind of closed space where you can easily transmit this infection. And that's why non-pharmaceutical measures in the absence of any real effective treatment or vaccination seems to be the way that we can manage transmission. That means, putting on your face mask, hand washing, keeping a physical distance, prohibiting large gatherings, and then to test. That's been another thing. And now luckily since November, we have vaccinations which are helping to slow down this transmission and over the next year or two end this pandemic. And sadly, a lot of the non-pharmaceutical measures, which are really basic public health measures for any kind of infectious disease, have become politicized in many parts of the world, and that's really made it difficult for the transmission to stop. And here is this virus, okay? The virus has no agency of itself. It's really people's agencies that is allowing it to transmit itself. So it's a small RNA virus. It basically carries a genetic code, which allows it to enter the human cell, and in particular, the epithelial cells in your nose and your throat, in your lungs, and infect them and hijack them to start producing more of the virus, okay? The way it does it, it has, just a few parts actually. There's the small envelope protein, there's the nucleocapsid protein, and the spike protein, which is really the protein of interest when it comes to vaccines. And it's a spike protein that attaches itself. It's all covered by the membrane, and that's why we say, oh, keep washing your hands, wash your hands, because it's very easy. Layer of fat is easily destroyed by soap. So what happens is when the virus multiplies, and there are errors that are always taking place as it multiplies multiple times in your system. And when those mutations become, a group starts sharing those particular mutations, that's when we call this a variant. It's not a strain, because the strains are basically SARS-CoV-1, MERS, and SARS-CoV-2. So within those, you get variants. So it's very important to note that although people in the literature seem to use strains, these are all just variants, meaning that there's a shared mutation that has happened so many times that it's become very distinct. If you recall, there were mutations that happened very early on. The first mutation that came through China was the D614G, which became the dominant mutation. It was just better at infecting your cells and replicating, as opposed to the ancestral strain from which it started. All of the subsequent variants have this particular mutation. Then we have another mutation that happens probably sometime in November, and that is the N501Y mutation, which helps the virus to latch on tightly. These are all happening on the spike protein. We see that in the variants that have emerged in the UK, in South Africa, and in Brazil. Forgot to put this, but the B681H mutation is also seen in the UK, not in the other ones. Then you have this K417N and T. These are actual deletions which help the virus to bind. And the mutation that's of interest is this one about the E, which weakens and allows us to have an immune response. And that's where the South Africa and the Brazilian mutations are of concern, because in some instances they're saying that the vaccines may not be as effective, but as yet there's not full evidence, and I'll discuss that later. Where can I go? So how do we control transmission? Because that's basically the bottom line of trying to control this pandemic. So testing is one key way of doing it. Why is that? Because when you test broadly, you can detect asymptomatic and pre-symptomatic cases. You can also have earlier isolation and better contact tracing of those of people who are the index case and then their contacts. You can also provide early care, which is very critical, especially for people who may end up in emergency rooms. And lastly, you can also try and track the emerging variants. So it's very important that countries keep testing, even though we have vaccinations now. Now, vaccinations are equally important because they help the virus to, they help us to recognize that there's this virus that is going to be attacking us, and it'll help us to develop our immunity and prevent the infection. It'll also help us to prevent severe disease and death. And that's basically what these vaccines have looked at in their clinical trials is, prevention of disease and death. And if you can get wide scale vaccination, you can actually help protect the community who, if there are people who can't receive vaccinations or who are refusing to get vaccinated, but if you have a critical mass, then the virus cannot replicate itself because it cannot find a host. So in terms of, we look at the how is this virus transmitting in a community or in a population. So that the influenza, for instance, has a reproductive rate of 0.9 to 2.1. So that means that each one case will possibly generate another one case or a maximum of 2 cases. With COVID, we estimate it to be about 2 to 4. And that means that any one index case is going to mean, double and eventually be exponential. So that's why it's very important that to get the R not below 1 to stop transmission, or to keep it close to 1. So there's only 1 to 1, but not to have it go rampant, which it has been in our various countries. So what they're saying with the vaccines, we need to at least have 70 to 80% people vaccinated in order to get any level of herd immunity. Now, this could be just within your own countries, your own communities, or it ideally would be global, but at the moment we don't actually have that much of a supply of vaccination to bring about global immunity. So in terms of testing, that's sort of the first line of defense for looking or limiting transmission. So there's 3 current tests on the market, and there's hundreds and hundreds of tests with the various level of sensitivity and specificity, especially when it comes to looking at antigen and antibody testing. But right now that there's sort of 3 critical subjects or the focus of our tests. So we have the molecular tests, which are basically the gold standard. They look at current infections. If you are infected, they will look for the virus and confirm that you are carrying the virus. Then you have the antigen test that look for the proteins on the surface of the virus, largely used for screening. And if they test positive, it's great, because that means that you can get a confirmation from a molecular test. The problem with the antigen test is when you test negative, because if you test too early, you might have the virus, but you may not have it in sufficient amounts, so the protein is not detected, and therefore you may need a repeat test. Then we have the antibody tests that are specifically after you have been infected, and they look for past infections. Now, the vaccines will look for these antibodies after you get vaccinated. That's how we know that the vaccines are working. We look for the antibody response. If you want to look at all the tests, and there's thousands of them, you can go to this finddx.org COVID-19 pipeline, and you will see all the tests that are currently under development. And in terms of the variants and testing, most of the testing platforms look at the nucleocapsid, look at the whole virus. They look at other aspects other than the spike genes, and they have multiple targets. And for now, the tests are quite robust against the emerging variants. Then we have some newer tests that are being developed, but not yet on the market. And I just wanted to mention them because the CRISPR gene editing test will be a game changer when it does get approved. It's very simple. It can detect it in 30 minutes, and it's comparable to the PCR testing. And it's a point of care test, so it will be very, when it does come on the market, it'll be very useful. Then we have other tests that are being developed, which are like sort of the biosensor tests, looking at electrical or optical detection, you can cough on a paper substrate, you could flash a light on your back of your throat to detect the virus. And I also found out that there are also now new artificial intelligence technology tests, such as cough apps, that are being developed to look at the coronavirus cough. So, you know, it's a very interesting and emerging field of testing for potential infection. Okay, now if we now turn to sort of the vaccines. So what happens with vaccines is normally you have an existing pathogen, and then our body, our immune system recognizes it by recognizing the antigen. So if you remember, measles used to be a very big killer for a long time. We have a measles vaccine, and now many children can be saved because as they're vaccinated for measles, the body recognizes and they don't get sick and they don't die. So this is a new pathogen. There's no antibody, and all of the antibodies, it's the spike protein that is very important because it's the one that infects into the cell, and all the vaccines that we're developing look to neutralize that aspect of the virus. All right, so in terms of in a general vaccine development, the endpoints are different. We would look at infection, we would look to see, you know, how you could prevent the disease. For COVID-19, because it was such a shock and overwhelmed our healthcare systems, initially, all the vaccines started to look at the endpoints as severe disease, especially preventing hospital admissions and preventing death. And very early on, the Chinese actually shared the sequence, the genetic sequence of the virus. So this was in mid-January, and so very quickly, that's why we could develop the diagnostics for testings. And by March, we were already doing the phase 1 clinical trials on animals, preclinical trials on animals and clinical trials on humans, because we knew what to look for, because we knew what the virus structure was. So that's one reason why there's been such a plethora of why the vaccines have been developed so early on. They've been so quick because we knew what the structure was. There were a lot of cases, and we could run the clinical trials that were necessary to measure safety and efficacy. So in terms of the efficacy, they looked at the difference in who got severe COVID and died, and people who got the vaccine compared to who got the placebo. So if you want, we can go through the clinical trial phases, but basically there's usually, 4 clinical trial phases. And the first one is a small group, and it's tested in like less than a dozen, then there's a few dozen, and then there's thousands. And the data that we have now is on several thousands of people, 20, 30,000 in some cases. And that's how, why these vaccines have been able to come onto the market and be administered into the communities. But again, efficacy is not effectiveness, and I want to make that point, because effectiveness is how does the vaccine work in the real world. Usually it's lower, that's the phase 4 clinical trials, and at the moment it looks like the vaccines are pretty effective at not only preventing severe disease and mortality, but perhaps even slowing the infection down, because the cases are coming down in some parts of the world where we know vaccination levels are high. So it may be possible that these vaccines can prevent infection and reduce transmission. But the current advice, not knowing exactly, is to continue to wear your masks, observe hand hygiene, keep your distance, and avoid crowded spaces. It's just, good public health practice. In terms of the vaccines, okay, how can I do this? So the vaccines, there are various different vaccine platforms. So the ones here in pink are the ones that we already are using. So the most common, which we've been using since the 1900s, is the inactivated vaccine. Currently, there's 11 of those and 4 which have been approved. Inactivated vaccines contain the virus that's been chemically or physically inactivated. In the case of COVID, it's chemically inactivated, it's inserted, and it induces an immune response. Then we have the recombinant protein vaccines, and they inject part of the virus into the to elicit a response. We have 29 of them. 1 has been approved already, and Novavax, which is the other vaccine, is looking for approval in May. 1 from Merck has been abandoned. Then we have the viral vector vaccines, which are more like a Trojan horse. They insert part of the virus into another vector and use it to elicit an immune response. Again, we have several vaccines, and I'll go through what the 4 that have already been approved using that particular platform. So the newest platform is really the RNA DNA vaccines, which pack instructions in a lipid nanoparticle and insert it and give instructions to the cell to produce the spike protein, which then elicits an immune response. You develop antibodies to the spike protein that the vaccine has given instructions to your cell to manufacture. The RNA quickly degenerates in your system, so it's not there anymore, but your system now recognizes and has instructions on how to manufacture that particular spike protein, which then your immune system starts to recognize. And we have 2 of those that have been approved, the Pfizer and the Moderna. And I should say this technology has been in development for a few years, so it's not like it came out of the blue. It's been around. So here are I think 12 or 13 vaccines that have been approved in several countries. We have 2 that are the mRNA. Then we have the Russian vaccine, Sputnik 5, which uses adenovirus 26 and 5 for viral vector. Then you have the Oxford AstraZeneca vaccine, which is the advantage of the viral vector vaccines is that they can be used. They don't require very cold storage. They only require refrigeration, and so they're very easier for us to distribute and manufacture. Then we have other vaccines. The Chinese have largely, they're at the bottom, have largely been using the inactivated viral platform for their vaccines, other than CanSino, which is using adenovirus 5 as its viral vector platform. All right, so here I've tried to put together a table for you to understand. I just put this, one of the questions is who can get vaccinated. So I just this morning just put in the ages. So you'll see that the Pfizer BioNTech vaccine can be given to children 6 and older. This is from the US FDA. I actually was listening in on when they were went through the emergency use authorization for this vaccine. And there was quite a bit of debate over the age group. And in the end, it was decided that it's better to give to 16, 17, 18 years old, rather than just making the cutoff of 18, because it was helpful. Its efficacy is 95%, and it's 2 doses, 3 weeks apart, and the cost per dose is estimated at around $20. It used to require -70, but they've modified it. So now it's just recently, actually end of February, and now that's just a freezer, -25 to -15 degrees centigrade. And Pfizer is saying that it is working on the booster. Sorry, there should be dots in between, against the variant emerging from South Africa. Moderna also is 95% effective, do 2 doses, 4 weeks apart, slightly more expensive. But here are the game changer vaccines, which are very relevant to lower and middle income countries, which are the Oxford AstraZeneca, which is used as chimp adenovirus, can be used in the fridge. Its efficacy ranges from 62 to 90%. It's 2 doses, 12 weeks apart, and the cost is very low. And recently, the US approved the J&J vaccine. I think it's also been, the asterisk is these vaccines are sort of approved in, also approved in Bahrain. So again, fridge in 2 months, slightly lesser efficacy of 66%, but it only requires 1 dose, which is pretty good for many communities. They are testing a second dose, and hopefully by May we will get some data on that over the summer. Then we have the Sputnik 5, which is also available in many countries, and I think they're also selling it to individuals as needed. Again, it's a virus vector. It's supposed to be 92% effective, 2 doses, 3 weeks apart. Its cost is also minimal. Although if you do go through a private purchase, I don't know what the cost may be. I know like in Pakistan, you can get it for close to about $200. Then we have the CanSino bio vaccine, so a 1-dose vaccine. It's about 62% effective. Then there's the Chinese vaccines, of which I think the most promising seems to be the Sinopharm Beijing Institute one, which is an inactivated virus. It's kept in the fridge. Its claim is around 79%. Again, the Chinese have not yet shared any of their phase 3 clinical trial data, so it's very hard to know exactly the efficacy. A lot of the efficacy is being based on phase 2 clinical trials. India is also developing and giving out their Covaxin vaccine. It's unknown efficacy, but it's 2 doses and can also be kept at room temperature. So what are some of the side effects? Most of them tend to be mild. In fact, I'm just looking to see how, because I've been part of the VAERS, the CDC has a system here where you can put the side effects that people are experiencing. It seems that most people experience side effects that are slightly longer, or they feel greater in severity after the second dose than the first dose. And wait, I just printed out what the side effects might have been. It's most of the seems to be like pain and redness and swelling, and where the shot is given, people have been reporting fatigue and headache and muscle and joint pains. Some people feel chills. Few people have had nausea and vomiting and fever. Nothing that is not resolved within the first couple of days of having been vaccinated. Seems like there are not very many cases that end up having, needing any kind of hospitalization or needing anything more than a Tylenol or paracetamol. So what do we want? We want this vaccine to be especially effective in older people, since they're the ones that have the highest risk of death and severe COVID. We want a vaccine that provides long-lasting immunity and prevents not only new infections and prevents new infection and not just illness. And for some of these things, we don't have the full information. We want a vaccine that has minimal side effects, and that seems to be the case. We would like a vaccine that doesn't require boosters, but with emerging variants, it may be possible that we will need boosters to these vaccines. And also not having any kind of long-term data, it may require that this becomes more like a influenza vaccine, or requires a annual shot or a shot every 2 years to make sure that your immunity is maintained. We want something that's easily distributed, administered, and cost effective. And we have several of the vaccines that do provide us with those options. Again, each country has adopted its own vaccination strategy. And in my case, where I sit in the US, each state has adopted its own vaccination strategy. But everyone does agree that the elderly and those with underlying chronic conditions, those in closed spaces, those who are healthcare essential workers should be the ones that are the highest priority. So that does seem clear. Some cases, we can give to people who are most likely to transmit the disease, but that's, some younger people who can bring it back home to grandma and grandpa, but that's not happening in many countries at the moment. So I tried to cover some of these things. I want to leave some. So safety and so basically we know that it's a safe vaccine. That's why we go through the clinical trials. That's why the FDA in the US and other regulatory bodies in other countries look at the data before they make a recommendation or agree for emergency use authorization that these vaccines are safe. So you can trust your regulatory body has done its work in approving these vaccines. So the other question people say is, can I get COVID from the vaccine? You cannot get COVID from the vaccine. There is no live virus in these vaccines. These vaccine platforms are all designed to trigger an immune response. You are carrying either an inactivated virus, part of a virus, or instructions on how to make the spike protein of the virus to trigger your immune response. So you cannot get COVID from this. So even if you go and wanting to test for COVID, what you will find is you will have antibodies to COVID and not COVID. Side effects are mild and allergic reactions are rare. If people have allergies and they go into anaphylaxis, which is like, you have an anaphylactic shock to some I don't know, peanuts or something, then you can trigger that kind of a strong response and you should not get vaccinated. But for everyone else, these are side effects are mild. And even then, people, when they are vaccinated, will be observed for about 30 minutes after vaccination to make sure. So for most of us, these vaccines are quite safe. For now, they seem to work against the variants, may not be as greater, they may not have a great efficacy because because of all of the testing that's happened against these variants has been in a lab in a test tube. So we don't actually know in real life what's happening, and we may need boosters. The other thing is you cannot become infertile with these vaccines. You cannot pass this COVID, you cannot have a microchip or tracking device. I mean, for all known purposes, these vaccines are quite effective and safe using those different platforms. Okay, I think that's it. I just wanted to say, in terms of, here's one of the charts I had, which I didn't forget to put in, but if you look at it, this was the most common side effect was really pain on the injection site, some swelling, and you have fatigue, which was especially reported after the second dose, headaches. So just for you to know, most of these vaccines are not having very severe side effects. All right. Okay, I'll end here. Thank you.
Well, thank you very much, Sarah, for doing this comprehensive review of all the vaccines under testing in a short time. Very much appreciate that. There are questions, and I think there will be more. So first of all, I would like to take the questions which are here in the chat box. I have already received a few questions from from people who have not been able to join in because of the various reasons. Time is one of the factors for them. Some of them are still working here on Saturday evening. So anyway, so let me start with the questions I have in the chat box, then I'll go over through the questions that I've already received. So the first question is from Dr. Danish Siddiqui. He's joining all the way from the UK. He's asking, once vaccinated with the live attenuated virus, how will it affect subsequent tests?
Okay, so I think I should say it's not a live attenuated virus, it's inactivated. Okay, so there are no vaccines right now that are injecting any live virus. It's a chemically inert virus that's being injected into your body. And what you will be testing for is your immune antibodies, so IgG, IgM, and you'll be looking at the neutralizing antibodies. That's what you will be looking for in terms of the effectiveness of the vaccine.
Okay, thank you. And there's another question from him. Is there any data that shows what promotes development of new variants?
Yeah, okay, so this is actually interesting. So there's two ways new variants emerge. So one is, over time, the virus wants to get better at infecting human cells, right? So it's multiplying in your system thousands, hundreds of thousands of times, and eventually, there's deletions, it's mutating, because not every, as you know, whenever you have cells multiplying, there's always small errors that happen, things, and it just becomes a fitter transmitter. It just becomes a much more fit virus. The second type of variants, the variants that we're seeing, the second kind of mutations that are happening, are mutations happening under people who have had long-term illness, or they're immunocompromised, immunosuppressed, and the virus is mutating to become more lethal. So that it's learning to multiply and find ways in which itself to make it more deadly to human beings. And that's how there's two ways in which we get new variants.
Okay, then there's another question. Oxford vaccines, I presume the person means AstraZeneca vaccine or the Oxford research vaccine. Are these vaccines taken 12 weeks apart? I think earlier they said, 4 weeks. So is that correct? 12 weeks apart?
Yeah, that they came out with some new data saying that after the first shot, the efficacy remains quite high. You see antibodies, above 60% in your system, and therefore they made a recommendation that they should be for 12 weeks apart. Again, you should see, how these decisions are made. It's like looking at the risks and the benefits, right? And given the short supply, a lot of these decisions are not based just solely on the clinical data, but also on the sort of the policies of what's happening, or the circumstances, especially in the UK. I think that was the one reason they made it, because they wanted to make sure that everyone in the UK got vaccinated first.
So on the same line, I mean, it's a query and question from me as well, because I wondered, because the trials they have done, I believe they've done 4 weeks apart, right? So I'm not sure how did that change to
Sir, question repeat, sir.
Please mute your microphone.
No, Sonu, do you have something to add?
I think maybe just by mistake, it seems.
Okay, but if someone has something to add, I haven't really looked at the AstraZeneca recommendations for why they have changed their thing, but I think it was because the efficacy they felt was good enough after the first shot that they thought that was safe to give it later, in terms of, it doesn't seem like the antibodies are there. If you recall, the initial level that we were looking was 50%.
Yeah.
And all these vaccines are above 50%.
So is this just a policy of the pharmaceutical company just to?
Yeah, I think so. I can look into it and then provide you
Yeah,
with a
yeah.
more
Yeah, I
thorough
think that's what
response. But
my thought was.
yeah.
Anyway, I think I'll move on to Sonu. Did you have a question? Sonu, did you have a question? You can unmute your microphone now.
सर बोले क्वेश्चन एक बार रिपीट कर देते सर जो क्वेश्चन बोले आप पहले
Question was the AstraZeneca vaccine that was 4 weeks apart initially. That
Yes,
was
sir.
at a period of 4 weeks, but that has changed to 12 weeks now.
Thank you, sir.
Okay. Okay, then there's a question in the chat box. 1 minute. So this is no, there are quite a few actually. Let me just go one by one. So now there's a question from Dr. Saima Jamal. She says, first of all, excellent and informative talk, Dr. Sarah. Are asymptomatic or pre-symptomatic patients less contagious?
There's contagion really depends on the viral load of each individual and the setting in which they're transmitting this virus. So it's not clear. It seems that asymptomatic people might be less contagious, but the data is not definitive. So that's why we continue to recommend that you should wear your mask all the time. What we do know is most of the nearly two thirds of the transmission that happens is coming from pre-symptomatic and asymptomatic cases. And I suspect that most of it, even within that, largely will probably be from pre-symptomatic cases, but asymptomatic cases are also transmitting virus. I can't quantify it like more or less at this point.
Okay, then there's another one from Dr. Danish Siddiqui. So the longer COVID-19 stays with us, more are the risks of developing a variant. Is it possible to have a variant that is not covered by the currently available vaccines?
So far, the variants are, it's happening in the spike protein because that's the spike protein that, it matters because that's how it latches on to our cell and enters our body. It might be possible, but I think it's just a sort of a weird, that's why you test and you do a genome and you track what's happening in every community, especially where cases are going up, because variants are more likely to develop where we have high number of cases. I think that given, how much people are collaborating and how fast science is moving, I think we will probably be able to keep ahead of this virus. I think that the variants have, especially with the RNA technology, et cetera, we can very easily adapt the vaccine to address the variants. And if we can contain the variants where they emerge, then we don't let them out into, the rest of the world. Then I think, I don't think that people in other parts of the world will need to worry about the variants. I mean, it's also about containment. If we can contain the variant very quickly from the site in which it's emerging from, or to track it, where if it does go into other countries and track those cases, then we will be able to manage the pandemic better.
Sure, thank you. Now, the next question looks a little bit difficult to me. It may be too early to make a comment, but just go for it, Sarah. So the question is from Mr. Rashid Zubairi, and he's asking which vaccine is more reliable?
I get that all the time, which vaccine is better, which frankly, I would say most vaccines on the market are very good, okay? Again, you just have to weigh your own, you have to look at the safety and your own risks and what are the potential harms of getting infected with COVID versus the potential risks of getting, getting a vaccine. That's how I would look at it. And I think the downside of getting a vaccine is very low. Any of those vaccines. I mean, I do hesitate until the Chinese share their data about their vaccines. But in the cases where the data has been shared, I think, and we have emergency use authorization, and in which some cases where it's been approved, you have to trust your regulatory bodies have done their homework. I think most of the vaccines on the market are safe, and I would recommend, if it was me, I would take any one of them.
Okay, so that brings on to a very similar question. And this is actually a practical problem in this part of the world. And I was going to ask the same question, but nevertheless, someone has asked. It's Mr. Ansari who asks, many tested for presence of antibodies post-vaccination. So after they had the vaccine, they have tested for their antibodies. And they have found that the decreasing titers of antibodies after a month or more, especially for inactivated virus vaccines. Would you recommend revaccinating these people? Should they take another vaccination? I mean, a different type, obviously.
Yeah, so this is after they got their second.
Yeah, they finished the course. They had the second shot. Now, they obviously, some of them, they are testing the antibody rise, how much it has been evoked by the vaccine.
Yeah.
Now, I've seen actually patients, some of them had zero titer, some of them had very little. So that is the problem. So what they are asking is, should they go for another, a different?
I'm not a physician, so I would leave a physician to answer it. But as a layperson, I would, if it was my uncle or someone, I would definitely say, please go get another vaccine. Because all you're looking for really with these vaccines is that your immune system recognizes the virus, launches an immune response to that virus. Okay, even with the efficacy, 60% efficacy, only means that you still have a risk of getting the infection. You still will get it. It may be a mild infection. It may be you're not going to develop severe COVID, but you would want to have antibodies in your system for the virus to be recognized when it enters. So,
yeah, I think I agree with that. That's probably the approach from what we physicians are adopting here, actually.
Yeah, I mean, it makes sense. I mean, I think, what would be very good is to start having a global database of some sort where we are seeing which vaccines in the real world are showing effectiveness and which are not.
Exactly. Now, there's a question or a comment on mRNA vaccines, Pfizer vaccine, basically. So initially, people were confused about this vaccine. And I think you have covered that already. I don't know if you want to add anything else. So the question is basically, people were not confident, they were confused. But I think it's quite clear. The efficacy, as you say, is 95%, and it hardly has any side effects. And at least I have not heard anything against it. And what I've seen in practice here, patients, once they've tested for the antibodies, they have got a very high antibody titer.
Yeah.
With the Pfizer one.
I think the mRNA DNA technologies is going to be the new, as we move further into the century, and I think will be the new way in which we will be looking to develop vaccines, because it's just far superior, and it's just providing your bodies with the instructions on how to, as I said, how to build those particular virus spike proteins or build the actual virus and then elicit a response. So you're not introducing any virus, and these things also degenerate very quickly in your system. They don't stick around.
Thanks for that. Now, there are two questions. I can club them into one. Basically, the participant is asking, what precautions we still need to adhere to after we have taken the 2 doses of vaccine? And the question added to it is, any guess when we will return to normal life?
If I knew when we could return to normal life, I'd probably be amazing. My guess is we're not going to return to normal life for another year or so. I think you might return to some form of normal within your own family group, your own community, or in your own particular setting, depending on, in Israel, where they're giving vaccination to most of their people. Maybe in Bahrain, you're doing the same. But globally, I'm not sure when that's going to happen. Yeah, it's totally unknown.
On that note, I think people have been asking about the herd immunity.
Yeah.
So when do you think, as a guess, when is that going to happen?
For her to be, I think in a particular setting, you need to have at least 80% of people vaccinated.
80,
So
yeah.
80%. So you can base it on your own region or your own country or your own. I mean, I think globally we will need to have 80% or so.
Yes,
And I'm
I
talking
think-
about sort of the 16 and above, because, at this point, we're not sure how safe the vaccines are in children. We haven't tested them, and the children are not being vaccinated for this particular.
Yeah, I think
virus.
that there will be a lot of variants, I'm sure, depending on the region you're living in.
Yeah, depends on how quickly, how many cases you're getting, how fast transmission is happening. That's why it's very important to adhere to the non-pharmaceutical public health measures. That's why
Yeah.
we keep saying, keep wearing your mask. Don't be like Texas.
Yeah.
It's not good to be like Texas.
No, exactly. I think people did become quite complacent after they had the vaccines introduced. So they thought, the corona or COVID-19 has gone. Okay, I'll move on to the next question. Okay, as virus is mutating, is it possible that vaccination will work with all variants? This is a question from Mr. Fazal Ahmad.
I think the virus is mutating. It seems that many of the vaccines are still eliciting antibody response, even though it might be a little less. But the companies are also trying to develop new boosters to deal with that. So I think it's just always going to be a cat and mouse game. We're all catching up to what's happening with the virus.
So I'll just quickly run through some of the questions I had received,
Yes,
Sarah.
yeah.
So the first question is, how safe is the COVID-19 vaccine? So that's again quite a broad.
I mean, you would run the clinical trials to measure safety and efficacy, right? Before you get any kind of approval from your regulatory body. So that means that vaccines that are currently on the market have met the standards of safety and efficacy as measured by these, clinical trials that, again, I mean, we know for phase 3 clinical trials are sort of the way that vaccine safety is assessed. And most of the companies or most of the vaccine developers have shared that data with us in peer-reviewed journals. So I think, many of these vaccines, at least half a dozen, are very safe and efficacious.
Okay, thanks for that. There is another question in the chat box now from Mrs. Najmur Seher Siddiqui. She's asking, is taking steam, gargle, taking vitamin C, zinc, etc., are of any use to protect ourselves?
Well, they're used to make sure your immune system is functioning well. I mean, they can't protect you against an actual virus, but what you can do is boost your immunity by, having less stress, sleeping enough, taking vitamin D, taking zinc. There are ways you can boost your own health to make yourself more robust against any infection.
Sure, thank you. Now there is a question from Mrs. Charmaine. She's asking, would you recommend another test to check for the antibodies 6 months or so later after being vaccinated?
Yeah, I would recommend that people, I think the government should start doing that. I don't think people individually should be responsible for it, but it would be ideal if governments have some kind of a framework to measure at what are the points in which, if we don't actually, because we don't actually know how long these antibodies will last. So, would it be ideal to measure them every 3 months or every 6 months? But we should have some framework to otherwise what will happen is as antibodies go down and there's another reinfection from somewhere, then we're going to start this cycle all over again.
Sure. Okay, so let me go through some of the questions which I've received. Now the question is, how were the COVID-19 vaccines able to be developed so fast? So that's
So I think
question.
I mentioned that first of all, we had the genome. We knew the genetic code thanks to the Chinese. We had a lot of investment. We had enough cases to run the clinical trials in different places. So we had robust data. It's a very unusual circumstances. So the reason why vaccines don't get developed is by the time we get around to it, there's not enough investment and the case numbers have come down. And so, for us to run any kind of clinical large trials of, thousands of people, it becomes very difficult. And then the money dries up.
Sure. Okay, then the next question is, what exactly is an emergency use authorization?
That's just a temporary authorization under an emergency situation because FDA is continuing to collect data on the side effects that were not detected during the clinical trials, right? So I said there's a phase 3, then there's the phase 4 of how that vaccine actually works in a real life setting. You really need that before you get full approval. So that's why they gave EUA in order for the vaccine, because they feel that the harm caused by the disease outweighs the safety risks of this vaccine. So that's why they just given it EUA. But in many countries, some countries have actually just given full out approval for some of these vaccines.
Sure. Okay, the next one is, what's known about the short-term effects of vaccine? I think they're asking for the side effects, basically.
Yeah, I think I discussed the
side
side
effects.
effects. Yeah, there's very mild, I think the most common one seems to be that there's which if anyone does get the mRNA vaccine, it seems to be a COVID arm is a very common side effect where you get redness of your arm after a day or two of on the injection site. A lot of people have reported just chronic fatigue and malaise. Very few fevers have been reported, but I think they all seem to be very mild side effects, and almost good to know they're having side effects that shows the vaccine is working and the immune system is doing something in your body.
Sure. Okay, there are a few questions. I'll just, I think you have answered already. You have actually covered in your presentation very well. So I'm just going to jump on to the question, which is regarding the absolute. Is there any absolute, or are there any absolute contraindications for vaccine? I mean, the COVID vaccine.
I think the only absolute is for people who have anaphylaxis, who have a history of having allergies, severe allergies to some foreign agent. But other than that, we don't have any contraindications.
Yeah, on that note, I think I've received patients who are a little bit, apprehensive if they have allergy like penicillin or egg allergy, for example. Like this evening, somebody was asking me, I've got penicillin allergy. Should I go ahead with the vaccine or not? So what is the advice on that?
I have penicillin allergy too. I'm going to get vaccinated when it becomes available.
Right.
I don't think, it's not, immune system is such a beautiful thing. It's not everything, right? So if you have a severe, to bee stings, if you go into like hyperventilation or shock when you get stung, but exactly. We're talking about like a level of allergies that's very severe.
Sure. But my answer to them is just, they'll need to observe you a little longer.
Yeah. I think if you feel you have to exercise your own caution and rational self. So if you feel like you need to be observed longer, stay around the site for longer than 30 minutes.
Okay, sure. Now, there was a lot of, apprehension again, the pregnant ladies or the breastfeeding ladies, whether they should be vaccinated or not. At one point, they say probably it's a relative contraindication or a contraindication. I believe they were not included in the study population. Is that right?
Yes, they're not included. They're now including them in future trials. But the American College of Obstetricians and Gynecologists recommends that they should not be withheld from a pregnant or breastfeeding individuals, right? I mean, again, I think people have to like make their own judgment call. We know that it doesn't cross the placenta, and we don't know, but and mRNA vaccines for sure are not a risk to breastfeeding infants or to the fetus. So might be, I think this is what I was talking to you, Dr. Raza, about us making informed decisions about which vaccine to give in which population.
Exactly.
Rather than some kind of just a random, pick one vaccine out of the hat.
Yeah. Okay, so let me just, I've got a few more here.
I think the other question you had is, should you get the vaccine if you've had COVID?
Oh, yes, exactly.
And I think you should get the vaccine if you've had COVID, because we don't actually know what antibodies have been developed in response to the COVID-19 infection that are going to be protective. So you just think about it. You get the disease, you don't know what's going on, whereas a vaccine gives you a set amount of what you know will happen. So I think it would be a good thing to take a vaccine even if you've had COVID.
Okay, I think there is a question, how Johnson & Johnson vaccine differs from Moderna and Pfizer?
So the J&J vaccine is a viral vector vaccine, and it takes piece of the virus in another, in this case, an adenovirus, and enters your system, and again, tells the cell that it has the spike has, elicits an immune response from the body. Whereas the Moderna vaccine enters your cell and gives your cell instructions to produce the spike protein.
Okay, good. Now, on that note, there is one vaccine I think you didn't cover in detail, but that's one I'm quite interested in. That's probably I'll go for, is the Novavax.
Yes, yeah. I haven't covered it because it's
in the pipeline.
It's still ongoing trial, but it's a very promising vaccine. I think if it comes onto the market and it gets its FDA approval, I think it'll add to the J&J, unless be another weapon in the arsenal against COVID. Yeah.
No, I'm anxiously waiting for the Novavax.
Yeah. I think May is when we'll get the phase 3 clinical trial results coming in.
Sure. I think there's again a question that some may not know the answer to it. Now, some people had taken monoclonal antibodies, convalescent plasma at one point when they had this COVID-19. So once they have this, so what is the time period that they should wait before they could have the COVID-19 vaccine?
I think you answered that question for me. I didn't also know about this, but the recommendation.
Just for the audience, I thought you may just
for 3 months before getting a COVID-19 vaccine.
Yeah. 3 months.
Yeah, but you should get it.
Yeah. So I think that's the bottom line. You should get the vaccine.
Yes.
Okay.
I mean, the bottom line is we should get the vaccine. The bottom line is we should continue to be tested. I think if you want to bring this pandemic, end it, sometime this year or next year, we need to remain vigilant.
Sure. Now, there's a question from Mr. Yogendra. Any special precautions for heart patients when they're going for a vaccine? I think that's what he means.
I would let you answer that, being a cardiologist.
No, not really. I think, yes, again, I see these patients on a daily basis. And again, they ask me a very similar question. And I say that, if they have got advanced heart conditions, I think they are the ones who should be taking actually the vaccine. Because heart conditions, chronic heart diseases, they do put patients at risk of, having a severe form of COVID-19. And that's what we would like to prevent. So if they have any chronic heart condition, yes, they should go for to receive the vaccine. And it should be done on a priority, I would say. Okay, and then there's another one. Now, if taken first dose and contracted COVID infection, do we need to take the second dose at defined time?
That's I don't know the answer to that one, but I think you would need to talk to your physician and see what the recommendation is. I think you would have to take a second dose, but I'm not sure if you would take it, within the time frame of the recommended vaccine or after the infection ends.
Sure. I think. Yeah, I think that's all for the questions I have got in the chat box, and that's all I had. These are the questions that were sent. So I'll just allow the audience, if anybody would like to unmute their microphone, and if they have a question, they may do so now. And if you have any other question, then please type in the chat box. I'll just give it a minute or so. So I don't see any question there, Sarah. So we have.
Hello, sir.
Yeah, please.
May I ask one question?
Yeah, please go on.
Myself, Fazal Ahmad. If I get any type of side effect from the vaccine, may I take its medication?
Yes, you should take your AIDS medication. You should not take your AIDS medication. In fact, people with HIV need to continue taking their medication. It's not contraindicative with the vaccine.
Okay, thank you, ma'am.
Yes.
Hello, doctor.
Yeah, Mr. Yogendra. Yeah, you can ask.
Yes, good evening, dear doctor.
Good evening.
Doctor, what about having both doses of vaccination done? Then can we travel in aeroplane? It's safe to travel all the way to US, let's say from Bahrain?
Yeah, I think you can travel. You just need to observe wearing your mask still, and you need to still take all the hand washing and the physical distancing, recommendations that will continue to be in place for a while. You shouldn't let your guard down just because you've been vaccinated.
But doctor, how about the atmosphere? Because all closed atmosphere and so many people in the aircraft.
Yeah, the way airplanes recycle air is probably much healthier than the way air is recycled in a restaurant or in a mall. So I think it's safer probably to travel in an airplane at this point, but you would still need to make sure you wear a mask because the air comes from up and goes out and then up again. So it's not circulated like the way it's circulated inside a more closed setting.
Thank you so much, doctor. Very kind of you.
With the question on mask, Sarah, so again, different countries, they have actually authorized different types of masks, including cloth masks. So do you think they are effective, the cloth masks? Or they should be basically what we wear?
I mean, I think,
mask.
again, it depends. Cloth masks will block some stuff. So better than no mask.
Yeah, exactly.
But if you can get the KN95 masks, I think they're probably, for average public, the KN95 masks are the most effective in terms of covering your face and your chin. And you just have to make sure that it's, there's no open space. I mean, people wear masks here and they put it below their nose and it's not worth it.
Sure. Now, there's one interesting question that has just appeared. From Sausan Assad, how to encourage people who don't want to take any vaccine?
Yeah, it was very hard. I think you have to tell them that, given what we know of COVID and we know the long-term consequences of it, because we're now seeing long-term COVID effects that people are having who've had it. I feel like when you talk to them, it's like really encouraging them that the disease is not really worth having, and if you can prevent it, you should be able to take the steps to prevent getting this disease. You know, but yeah, I totally hear her. It's very hard, very difficult sometimes to convince people who feel like, you know, they're not at risk. But I think everyone is at risk, really.
Yeah, I feel there are two groups of people who are not ready to take. One, they feel that they're not at risk, and they do not believe in COVID-19. The second group of patients, they are quite afraid or apprehensive, you know, about the side effects mainly.
Yeah.
So I feel these are two groups who will be difficult to actually convince.
But I think you can manage the side effects, people, with enough data to show, you know, that it's not so terrible. I think it's
Yeah.
the first group that's very hard.
Yeah, exactly.
Yeah.
So is there anyone who would like to ask any question? You can still unmute your microphone if you like. If not, then
Yes, I want.
yeah, Mr.
Yeah,
Rashid, yeah, please
Rashid.
go ahead.
Yeah,
Please
how
go
are
ahead.
you? Yeah, I already took 2 doses of Sinopharm. Suppose in future, if some result says that it is not so effective, can we have another vaccination again? Some
Yeah,
other
I think you
vaccine?
can get another vaccination again, but it depends on which Sinopharm you took. Did you take the Sinopharm with the Beijing or
Wuhan.
Wuhan?
I think that's what we were discussing,
I don't-
Sarah, just now.
that-
Before the...
No, whatever is available here in Bahrain, that I took. I don't know which one.
I think that the Bahrain is the, isn't the Beijing one available, or are they both available?
No, I think I'll have to check that
Not-
out. I don't know myself.
I think the Beijing one is the one that I saw was available, and I think that has a pretty good efficacy. So you should be okay. But if you had the Wuhan one, and like I said,
Yeah.
if you don't have the antibody titers, you should think about taking another type of vaccine that's more effective.
I don't have any feeling, any pain, no fever, nothing
No,
happened.
that's okay. You may look. Everyone.
No. What I'm saying, after taking this vaccination, I don't feel any pain or anything, whatever side effects. No, nothing.
Nothing, yeah. No, I mean, look, not everyone will have side effects, okay? Because everyone's immune system is different. I think what you need to do if you are worried about whether you have, effective or vaccine is you should go and get your antibodies tested for the vaccine, for the virus, I mean. Go and get your antibody titers measured.
No, this is again a
Thank you.
third-hand information, Sarah. I've got from someone that we have probably both Wuhan and Beijing Sinopharm, both.
I think you have, that's what I was
Both.
thinking that.
Both, yeah.
You
In what
have,
proportion, I don't know, but we have both.
Yeah. But I think the Wuhan one is problematic.
Yeah.
And personally, from reading
Yeah.
the data.
Yeah, but this is a very typical scenario what Mr. Rashid asked just now. So this is not the first one to ask this. So this is a very common problem. Now people have not seen any one. They feel some say it was like some water injected. It may not have been vaccine because it did not cause any kind of effect in terms of even mild side effects.
Yeah.
So that's what they are questioning now on the vaccine.
But I think for such cases, you should recommend that they go and get their antibodies checked to see.
So yes, some of them have checked, and as I mentioned earlier, I think before we started the meeting, so some of them have not seen any antibody at all, and some they have seen very little rise in the antibody.
Yeah.
So that's where the people are losing confidence.
Yeah, no, I think you need to track that vaccine is not very effective, and the data has not been shared about it.
Exactly.
And I think the Chinese are giving it to their population in large numbers.
Yeah. Okay, I think we are already 1 hour 23 minutes. So I don't see any. Is there any other last? I would just make an announcement. Any last moment question? Anybody has a question to ask? You can unmute your microphone if you have a question. So with that, I think I thank you all, audience.
Hello, sir.
Yeah, please.
Can a pregnant woman take a COVID-19 vaccine? Is it safe for pregnant women?
We don't have the data because the clinical trials didn't include enough pregnant women. We only know from the women that became pregnant in the clinical trials. And from that limited data, the recommendation is that they should not be excluded, but that decision should be
Okay.
made with the obstetrician whose care she's under.
Okay.
Okay, so with that, thank you very much, audience, for staying with us. It's late in few countries, particularly people who are joining from India and Pakistan. And thank you very much for being us. Thank you for putting in the questions. I think it was a wonderful session discussing a lot of questions, answering your queries. And so with that, I thank you very much, Sarah, for being with us on a Saturday afternoon for you and spending time here and answering the questions to the best of your knowledge and ability. So with that, thank you, everybody, and have a wonderful day ahead.
Great.
Thank you, Dr. Raza, and thank you, Sarah. We have been very kind, Explanation was superb and very informative and to the point. Thank you so much.
I'm glad.
And thank you, Dr. Raza, for conducting it so well,
Thank you. Thank you. My pleasure. My pleasure. Thank you very much for attending.
खत्म हो गया जी।
हेलो